well, PT. I'm so glad you're here to learn a little bit more about your health and wellness. Today's topic is going to be cervicogenic headache. That might sound like a really fancy term, but it's quite simple. Really, all it is a pain that's generated by your neck, but you don't necessarily feel neck pain. What you feel is a referred pain or pain somewhere else in your head. You might have that yarmulke type pain location, or it might be this ram's horn or pain starting from that frontal lobe coming back and running along the side of your head. These types of headaches can be confused with some other types of headaches that are pretty common, one of which is tension headaches. Typically you find pain in this temporal region with those tension headaches. And with tension headaches, usually the cause is something like stress or hunger or some kind of environmental factor. So definitely take note of your environmental factors and what might be affecting you personally. But something that can be really beneficial is things like meditation, physical activity, and then soft tissue. So rubbing around that pain area. And then if you do have neck pain, because it is common with tension headaches, rubbing that area out is probably your best bet for relieving those headaches. Migraines are another type of headache that may get confused with cervicogenic headaches. Unlike tension headaches that are bilateral, migraine headaches are usually unilateral, and they're typically felt right here. With migraines, you can have an aura, which is that halo type light sensation, or you can have a non-aura. With auras, they last about 4 to 72 hours. With the aura, they typically last around 30 to 60 minutes, and they're relieved by lying down, taking a nap, that kind of thing. With migraines, it's key to know your triggers. Know what things trigger you, whether it's food, whether it's stress, whether it's coming down from stress, lack of sleep, light. All of those things are so important because the best way to treat a migraine is to prevent a migraine. Some other things to watch for with migraines is you're gonna get that nausea, vomiting, you're gonna get the photosensitivity or the sensitivity to light and sound, which makes it different from the other two. With tension headaches, you may get one of those, but not all three. And back to our cervicogenic headache. Like I said before, that pattern is in that ram's horn or that top of the head, or even sometimes in the neck. That is pretty common as it generates from the first 3 cervical spines, C1, C2, and C3, and your neck. There are nerves that run out from those vertebrae into our neck muscles. So sometimes having tension and tightness and lack of mobility in those muscles is a sign or a cause. So if you want to test yourself, you can just push down on those vertebrae and you feel tenderness. That might be another sign. Lack of range of motion is another sign. So you might not be able to turn your head fully or tilt it side to side or look up or look down fully. So that's another way that you can tell. Often the first line of defense for a cervicogenic headache is seeing a medical professional, such as a physical therapist, because manipulation and mobilization do an incredible job at relieving your pain. However, if you want to troubleshoot on your own before going to see a professional, these are some exercises that you can do.
Let's get down to business. Give you one more night to get this. We've had a million nights just like this. So let's get down to business. Mama, please don't worry about me, 'cause I'm about to let my heart speak. My friends keep telling me to leave this. So let's get down to business. Let's get down to business. Give you one more night to get this. We've had a million nights just like this. So let's get down to business. Let's get down to business. Give you one more night to get this. We've had a million nights just like this. So let's get down to business. Back and forth with the bullshit. I know I said it before, I don't mean it. It's been a while since I had your attention, so it might hurt to hit it. Dreams we had don't ever fall away. stay the same. And I can't do this for another day. So let's get down to business. Let's get down to business. Give you one more night to get this. We've had a million nights just like this. So let's get down to business. Let's get down to business. Give you one more night to get this. We've had a million nights just like this. So let's get down to business.
Let me know how those exercises went, and if you want to learn more about different types of headaches and how I might be able to help you relieve those headaches, reach out to me. I'm found on itiswellpt.com, or you can reach out to me directly at itiswellpt@gmail.com, because honestly, I would just love to help you find freedom from your headaches.